So just individually and quietly to yourself, if you wouldn't mind just thinking about, have you ever taken a language class? And if you have, how useful was it for interacting outside of the classroom? So let's just take 30 seconds and each of us just think about these two questions and then we'll get started. Okay, now that we've all reflected, I'd just like to ask you to keep that in the back of your mind as you're listening to the presentation, but I will share my answer. I took 4 years of Spanish in high school, and then that was my major. Spanish was my major in college, but I left college feeling like I couldn't really handle a conversation in Spanish outside of the classroom. I was taught a very standardized version of Spanish that really only exists in Spanish textbooks. And to be blunt, I felt very ignorant about the Spanish in my community and elsewhere. So just to give you a little bit of background about me, before coming to UCR, I was a Spanish teacher. I taught in elementary schools, both public and private, and immersion schools and Montessori schools. And I even taught English over in Argentina. So I've seen language instruction in many contexts, but always something was coming up short for me. So either the curriculum was too grammar focused, or when culture was presented, it was in a very generalized, superficial way. And I searched for programs and curricula that were better, that were more critical, but they just simply didn't exist. So that's why I came to UCR, to try to make a better Spanish curriculum. So first, just a little bit of background about why authentic materials are so popular now in Spanish education. So first of all, the research in second language acquisition actually proves that grammar-intensive approaches are ineffective. So for beginners, content is what's most important. So this is, nouns, verbs, and not grammar rules, because they simply cannot internalize these complicated grammar rules at a beginner level. Also, the Foreign Service Institute reported that even under ideal conditions, it takes at least 720 hours to achieve a superior level of proficiency. So this is many, many years of studying a language, and many programs today, because they're so grammar focused, they try to cram in all the Spanish grammar that it has to offer in 2 years, when research has shown that our brains simply cannot handle that. And so we're holding students to a higher standard than they're actually physically capable of. And so because of this, some instructors have read the research and they're shifting their approaches to more proficiency-based, more instruction the students can handle. But, and one of the tools they use for this is authentic materials. And then the kind of general question that my research addresses is, what kind of Spanish instruction is meaningful and important? It's very broad, very general, but what I am arguing is that, of course, we need to get away from just grammar in Spanish, but I don't think that proficiency is the answer either, because even when I was able to hold a conversation in Spanish, when I went back and I felt ignorant about the people I was speaking to, I felt like my Spanish classes had really failed me, because I wasn't aware of the socio-political struggles. I wasn't aware of how language connects to power in any way. And so I think we need to go a little bit further than just proficiency. And that's really where my research is. But today I'm just going to be focusing on authentic materials, which finally I'll define for you. So the American Council on Teaching Foreign Languages, they define an authentic material as one that is written by members of a language and culture group for members of the same language and culture group. So this is very broad. It's essentially any material that isn't created for classroom purposes. So this could be a menu from a Spanish-speaking country. It could be a song, literature, and then These are some of the typical approaches when it comes to authentic resources. This is a Twitter thread where instructors can share ideas on how to use authentic resources. So the first one here, you see these instructors had their students watch a YouTube video, but really they were looking for grammar trends in context. And this second one here is just an ad from a Spanish-speaking country about, I guess, the word for eating chicken nuggets in Spanish. So you can see that they're very superficial and they're still language and grammar focused, and they're not asking students to be critical in any way of the material. And I have a close-up here of that first activity. So really, it was just students listening to an audio from YouTube, and they had to fill in the blank with what words they heard from the YouTube video. So essentially, it's just another grammar exercise. And the implication with this is that teachers believe that if they just simply use authentic materials in the classroom, then students are being exposed to different viewpoints, different perspectives, and they're just sort of going to magically absorb those. But I argue that we have to explicitly address them in the classroom and have these larger conversations and actually be critical of the authentic materials, because just like any material from anywhere, really, it's going to have stereotypes, biases, and we need to address those with the students so we're not inadvertently promoting them in the Spanish classroom. So some of the issues here, when the goal is only proficiency, activities using authentic materials involve very little critical thinking. So what actually happens then is students believe, for example, that Spanish is not an academically rigorous subject, it's not important, or it's not difficult. Another issue is instructors and students also may assume the material is representative of the target culture. So here we have the danger of the single narrative, right? And finally, another assumption is that authentic materials are inherently free of biases and stereotypes. We know that's not true. So if we're not addressing it, then the students aren't going to get that, and we are actually promoting those stereotypes. So this is my example of what would be considered an authentic material, right? This is an ad, it's in Spanish. It says, it's easy being a man, right? When you have your beer and you have your buffet of ladies to choose from. So imagine if we presented this in a Spanish class and we only looked at the language, we examined it for grammar. What kind of message are we sending to the students regarding the target culture here? So these next few slides are kind of my rough version of reworking this. So how can we change this approach? How can we go a little bit deeper? How can we be more critical? And so bear with me because this is just a work in progress. These are just some ideas that came to my mind, but I haven't fully developed my approach yet. So what if instead we asked first, what comes to mind when you think of beer ads? What do you notice about this beer ad? In one word, describe the women you see, describe the overall message of this ad, right? So this is something even a beginner level class could do in Spanish. They could elicit one word, and then there could be a discussion afterwards in English, because there's this giant assumption that in Spanish classes that the target language has to be used 100% of the time, when research has also shown that that's not simply true. The students have to actually fully understand the message to be able to use the language and to be learning. You can't just expose it to them and they'll just absorb it. So I argue that really we could still do these linguistic tasks, but then have a deeper conversation about other issues that are affecting the target culture. And so that way students are more informed. So an example of some activities we could use, we could look at other beer ads and compare them. What sort of messages are they sending out? What do they say about Latino women, Latino men? How are they racialized in beer ads, right? And of course, we have to connect, anytime we use an authentic material, we have to connect it to the larger dynamics from that context in which it emerged. So this could be, for example, with the beer ad, connected to larger issues of gender discrimination in language. This could be inclusive language, which is a really hot topic right now in the Spanish-speaking world. There are a lot of really strong opinions for and against inclusive language. The class could also talk about femicide in Latin America and Spain, machismo. They could read articles about these and discuss them. And then in my approach, of course, there always has to be some sort of action. So just something that came to mind for an action item the students could do that involves someone outside of the classroom and to where their work is being heard by others. They could create a children's book about inclusive language and share it with the local elementary school or library. That way their work has more importance than just inside the classroom context. And another idea is they could look at memes. So this is a meme about inclusive language. It says, "Are you a feminist? Yes. Okay, then say the word for shoulder in inclusive language," which in Spanish would be hombre, which is the word for man. So that's why you see this reaction. So there's a lot to unpack here. And these are images that are appearing in the students' lives. And the fact that we're not addressing them is we're just really missing an opportunity here. So therefore, there needs to be a critical and anti-racist method of teaching authentic resources so students can question root narratives, underlying assumptions, stereotypes, and biases of the materials they are presented. This empowers them to be agents of change and to take direct action against linguistic justice. And many of you think that maybe this sounds obvious, but this field is not there yet. The field of Spanish education is simply not there. I searched far and wide for a curriculum that I felt comfortable with, that I felt I could accurately explore the nuances with my students, that I could have some sort of component of social justice, and it simply didn't exist. Even at UCR in our Spanish classes, we use the grammar-focused approach, and culture is very, very superficial. So lastly, my next steps for my research, I'm going to design a classroom study using two groups. The control group, they will receive traditional instruction using authentic materials that the field is promoting right now. And then the experimental group is going to receive instruction using the same authentic materials, but more critical pedagogies like I showed here, where we're diving a little bit deeper and we're taking more action. And then my hypothesis is that students in the experimental group will have increased desire to continue learning Spanish and will have better performance on assignments due to a higher level of motivation, because their work is going to be more meaningful to them, and it's going to have some sort of outside importance other than just the Spanish classroom. And then what I'm working on developing now, I'll need to do the study and figure out the findings first, but I would like to develop a critical anti-racist approach to Spanish language instruction, because there's just a lack there when it comes to the practical application of both anti-racist pedagogies and critical pedagogies, but particularly when it comes to language education. So my work I would like to contribute to that. So that's it. If anyone has any questions or feedback, I would love to hear them, and thanks for listening.
Thank you so much, Melissa. We're going to ask folks to note down your questions, maybe put them in the chat now if you'd like to, and then we'll have 20 minutes for question and answer at the very end of the full panel, if that's okay with everyone. So our next presenter is Jessica Gutierrez Masini from the Department of Music, now in the 5th year of the PhD program, sponsored by the Performing Difference Faculty Commons. Jessica's field is ethnomusicology with an interdisciplinary research interest in Native American Indigenous Studies, Latin American Studies, and feminist and decolonizing methodologies. And the paper we will hear today is entitled "Doing Research in a Good Way, Decolonizing the Group Interview Through Talking Circles." Thank you, Jessica.
Oh, thank you. Let me share my screen here. I don't have, oh, there it is. Sorry. Let me move this over. Okay. Mia Huen Umon. Hello, everyone. Nen Natal, Jessica Margarita Gutierrez Masini. I introduce myself in Cahuilla as a way of introducing and thanking the peoples whose lands I'm speaking from today. I also acknowledge the Serrano, Luiseño, and Tongva peoples as neighboring and overlapping tribal lands and waterways. Week by week, I am learning more about the history and complexities between danza, an indigenous music, dance, and spiritual practice from Mexico, and powwow, a North American intertribal music and dance celebration. As a danzante, danza dancer, I value my time in ceremony. I reframe my researcher prerogatives, just be in the field, and letting the restorative processes of dance and movement take effect. As a researcher, volunteer, dancer, and activist, the boundaries of my field sites are ambiguous. I quickly learned that my greatest decolonizing tool in music studies is listening. Building upon Stolo professor Dylan Robinson's decolonial critique of sonic encounters between indigenous traditions and Western music, I implement a kind of engaged listening process that attends to the relationship between listener and that person being listened to. By reorienting our listening relationship to what I call compassionate listening, my work reintroduces subjectivity and emotions into our scholarship, while reversing the extractive legacy of historical research within Indigenous communities. Compassionate listening is a decolonizing strategy where the intention of listening is not based on content or extraction of knowledge, but creating reciprocity and letting friends and interlocutors construct the research narrative. In working with Native American communities, compassionate listening works to counter hesitation these communities have in trusting traditional knowledge to outsiders. As a fellow scholar of Indigenous ancestry working within the academic institution, I hope to strengthen the links between decolonizing research and supporting Indigenous self-determination. I am inspired by Mohawk scholar musician Dawn Avery's use of talking circles in her group interviews with Native composers, because it gave every member a chance to speak on a particular topic. So I thought, what a great way to decolonize the group interview. Then I immediately thought, wait, is this appropriate? So I started to do some homework. Most of my preliminary research on talking circles and academic articles were in the health and public policy sectors and used unfamiliar jargon. Fortunately, talking circles have found their way into classrooms as pedagogical tools for structuring class discussions, both in person and online. Considering the COVID-19 pandemic changing my research plans, this became an opportune time to try a talking circle proposal. Like sharing circles, talking circles are about dignity and respect given and received by all, and often create a sense of community. They can explore community tensions or resistance and facilitate listening and learning together through 4 stages: building connection, piercing the surface, delving deeper, and reflecting and learning. According to First Nations Pedagogy Online, when everyone has their turn to speak and all voices are heard in a respectful and attentive way, the learning atmosphere becomes a rich source of information, identity, and interaction. Rather than focus on my desires and needs as a researcher in the interview, I facilitate a dialogic process that builds trust, relationships, and good energy. On April 15th, 2020, I emailed a proposal to 4 friends and interlocutors for an online group interview that loosely followed guidelines from Native American talking circles. I first met Josh Little, Ogola Lakota, Josh Gonzalez, Chitlaka Mexica, Will Madrigal, Cahuilla Luceño, and Cuauhtémoc Paranda, Mescalero Apache Mexica Chichimeca, through Native American student programs at UC Riverside, or NASP. They were prominent voices in my master's thesis. However, due to limited time and resources, I did not have a chance to bring them all together and discuss some of the tensions brought up in separate interviews around transnational understandings of indigeneity. Most importantly to me as a researcher is this process of checking in and re-listening to my generous friends who have taught me so much these past 5 years. Here they are pictured on this slide. I also checked in with them on these photos for this presentation. The following slide is a screenshot of my interview questions from the proposal that I had given to my participants. Note that there's a lot of text, but this is just to show my process, that I did my homework and I had a plan, even if I did not quite follow it. So as you can see, we have the interview questions and they are organized into the 4 rounds of a talking circle. Beginning with building connections, this often has some sort of opening prayer and medicine is offered, often an icebreaker or check-in for folks who are, meeting for the first time or introducing themselves the way they want to be introduced. There's also a time of going over guidelines and protocol that we all have agreed upon. The next round, piercing the surface, is about defining a topic and then everyone revealing personal connections to that topic. There's often storytelling or sharing. And what was a very enlightening experience from my talking circle and the inspiration for this paper was discussing what it means to do things in a good way. I've always wanted to dedicate time to understanding this phrase so often spoken among my Indigenous friends and interlocutors. During the end of our opening round of commentary, Will Madrigal brought up "in a good way" at the end of his turn, and the next round, piercing the surface, was supposed to be on Danza and powwow and a clip that I had recorded from the 2018 powwow we had all coordinated and participated in. Instead, it became this very reflective moment between the 5 of us on what doing things in a good way meant. And then the next round, delving deeper, we would explore problems, entertain new ideas. This is also a stage for grief and conflict resolution. And there were tears shed in this moment. Lastly is reflecting and learning. This involves empowerment and reflections, appreciation, some sort of checkout process or closing, sometimes a song. In our talking circle, I had asked everyone to give a piece of advice from what they had, we all had discussed, and to take with themselves moving forward. Now, protocol is always at the forefront of my mind. Would talking circles be appropriate or appropriative? I demonstrate my anxiety and openness in navigating this question through a written sketch between myself and Will Madrigal last spring. Will Madrigal was the first to respond to my proposal and called me the following afternoon. I answered my phone with a thumping heart in my chest. I thought, was he offended or felt called out from his comments in my thesis? Did I ruin our relationship and rapport by suggesting a talking circle? "Mi'ihue, Will, how's it going?" I greeted him timidly. His cheerful reply that he and his family were doing all right immediately pushed back my initial fears. Will brought me back to the present. "So, hey, the reason I'm calling is about your email yesterday." The lump in my throat makes it hard to swallow, so I reply, "So I wanted to talk to you about the talking circle. Have you ever been in one?" This is it, I thought. He's going to call me out on being appropriative. Why didn't I attend any of the talking circles started this year in NASP? After a pause, I deny that I've ever been to one and felt the need to reinforce that I've been learning extensively on their pedagogical use in classrooms. I ramble on that I did not see myself as an expert or spiritual leader. However, I hope that this approach to sharing, listening, and learning together could guide our conversations. I don't breathe as I wait for his commentary. Will shares that he's been to a few, then goes on to explain the talking circle process, which was supposed to be a sort of spiritual or psychological exercise together. He says, "It's a lot like what's on that First Nations pedagogy site you showed. We are in a circle, there's a talking stick, and whoever is holding it gets to talk. And it is the responsibility of everyone participating to listen and of the teacher elder to facilitate." Of course, I thought, this is too sacred for an interview. What was I thinking? I hope I can fix the situation. He compares the talking circle to a peace pipe or sweat lodge ceremony, asking if I've ever been to one of those, but I shyly reply, I have not. He continues, "There is no expectation of expressions. Some cry. There is protocol, often prayer and smudging. It is a very emotional, interpersonal thing." I thanked Will for sharing with me and that I would rethink our group interview because my honest intentions were to check in and follow up in a good way with them. Will said, I think it's appropriate for a follow-up. The talking circle? I asked, hopeful. Yeah, it reaffirms Indigenous teachings and ways of knowing and doing. At the same time, you are using this in a good way. Hot tears began to stream down my cheeks. I felt like a boulder had been lifted off my chest and the lump in my throat cleared. Breathing steadily again, I shared my gratitude for his words and blessing. I was so nervous that he and the others would scoff at the idea. Will reassured me that we were good, and I could imagine his smile on the other line as he explained how elders teach us a humble heart approach. Our phone conversation ended soon afterwards, and I sat there relieved in warmth and love. The scene I just shared demonstrates the fears and insecurities of fieldwork, often left out or unedited due to informality. Or perhaps it is perpetual anxiety of my own imperfections that I am afraid to commit to paper. However, I push these obstacles aside because I believe this vulnerability in doing things in a good, slow way is what Will references in our phone call. Our Talking Circle group interview took place May 2020, and the contents are explored in other parts of my dissertation. Our Talking Circle was successful in reconnecting with each other, diving into my research questions, and talking and thinking through Indigenous identity. Reflecting on this experience over a year later, I'm convinced of the benefits that talking circles with proper preparation, permission, and humility have in approaching group interviews, especially with Native peoples. While I cannot advocate for every interview situation, decentering the researcher as investigator and participants as knowledge bearers aids in creating a multi-layered meaning-making experience that everyone can contribute to and learn from. By focusing on listening to the persons and non-persons being listened to rather than the results of my research, I practice compassionate understanding and sitting with our knowledge sharing process. I also acknowledge that talking circles are more successful with a community built on mutual trust and respect. I'm continually humbled and admire their trust in me in my research process. I recognize that my understanding of doing things in a good way for this paper is heavily male influenced, considering that 3 of the 5 participants are cis men and 1 two-spirit butch queen. Moving forward, I am making efforts to incorporate more women and two-spirit perspectives, as well as my own feminist poetry as a way of processing talking circle experiences. Through talking circles, I have learned to learn. Achima, thank you.
Thank you so much for that wonderful presentation, Jessica. I'm excited to see questions and conversations that are going to emerge, even just from the 2 papers that we've just seen. And I'd like to introduce the 3rd presenter, Gabriela Ortiz, who's a 2nd-year graduate student in the Department of Anthropology in a subfield of medical anthropology, and is sponsored by the Inequities in Health Faculty Commons. Gabriela will be speaking on Platicas as public health through online engagement.
Hi, everybody. Thank you for being here. Again, I just want to reiterate, thank you for spending your Wednesday afternoon with us. Okay. And I hope that everyone can see my screen. Okay, so today I'll be presenting on the work that I was a part of during the summer of last year, which focused on creating the infrastructure to provide free and routine COVID-19 testing to farm working communities of the Eastern Coachella Valley. And this project was led by Dr. Ann Cheney, a medical anthropologist in the UCR School of Medicine, and Maria Conchita Posar, a community leader and researcher. a little bit on the research setting. It's located in the Eastern Coachella Valley, which is approximately 90 miles from the US-Mexico border. And our efforts focused on the 4 unincorporated rural desert communities of Thermal, Mecca, Oasis, and North Shore. These communities are predominantly monolingual Spanish-speaking foreign-born Mexicans and Latinx. And it should be noted that the Eastern Coachella Valley is also home to the largest indigenous Mexican Purépecha community in the US. Has a population of about 20,000, and anywhere between 20 and 35% of the population work in agriculture. And an overwhelming majority of those folks live well below the federal poverty line. And so while the mainly undocumented workforce provides their labor and contributes to the local and national economies, their marginalized status and structural vulnerability places the residents in a state of precarity which can limit access to social and healthcare services. And so in knowing this, it should be noted that language, literacy, and citizenship status are also documented barriers in accessing healthcare services. And although there are dedicated healthcare providers in the area, the number of doctor remains alarmingly low, which is at 1 doctor per every 8,500 residents, when the federal government recommends 1 doctor per 2,000 people. And so it was in this context that the project to provide COVID-19 testing to these communities emerged. The project had 3 main goals, which was to support the COVID-19 testing and contact tracing for farm working communities. In the end, we were able to establish to bring in 26 mobile testing sites across various locations in the Eastern Coachella Valley, with a total of administering 1,470 COVID-19 tests. The second aim was to disseminate COVID-19 public health information materials to the farm workers and their families, with the third aim to conduct research on COVID-19 perceptions and behaviors and future vaccine uptake. And so at the start of this project, in September 2020, Riverside had the highest number of COVID cases in California, with the rural communities of the Eastern Coachella Valley consistently reporting a steady increase in COVID infection per 1,000 residents. And so this presentation will focus on aim 2, which is the public health information dissemination efforts across the Eastern Valley. A little bit on the methods. We used a collaborative research approach that equitably involves various community stakeholders in all phases of the research and is rooted in an understanding of the social and structural forces which contribute to health disparities. In total, we held 7 focus groups, and one of those 7 focus groups was held in Purépecha. We used a template and matrix analysis, a rapid qualitative analysis technique. But in addition to that, most, if not all, of the team members individually read the focus group transcripts, and our research team was composed of medical students, pre-med students, and promotores, and we all analyzed the data together to identify themes, patterns, and key quotations. Briefly, a little bit of the focus group findings. The common theme was misinformation, which was attributed to a lack of reliable public health information. Second was a lack of trust in institutions, namely public health, government, and medicine and science. And third was the theme of insecurity, the insecurity of employment and insecurity due to their immigration status. So it's interesting, it's interesting that the Platicas were established before we started the focus groups. And so it was at that point that when we gathered and analyzed our data, the common theme that emerged was this misinformation, which was attributed to both a lack of reliable information, but also a lack of access. And so the Platicas, it started because the promotores, they're trusted members of the community typically, in this particular case, definitely. And community members confide in them. And so they learned that there was a critical need to provide reliable information from trusted sources. And in this particular case, those sources were the promotores. And as our findings indicated, there is a deep-rooted fear and lack of trust in public health institutions. And so we started our series in September 2020, and the goal was to provide consistent and reliable and accurate COVID-19 information for the Spanish-speaking communities of the Eastern Coachella Valley and the Purépecha-speaking communities. Our Platicas ranged from various topics, anywhere from COVID-19 testing to the effects, what it feels like, to the myths associated with COVID-19 itself and the testing, to also topics regarding mental health support during the pandemic and vaccine information. Since September 2020, we have now held 36 Platicas. They're done every Wednesday, so today, from 7 to 7:30 via Zoom and Facebook Live. And the questions, community members have the opportunity to pose questions to the Dr. Martin Rascon, who is a physician from Mexico and also worked with us as a promotor de salud on the project. Additionally, UCR medical students join us consistently and provide support to Dr. Martin Rascon. We've consistently included Purépecha interpretation in the episodes, thanks to our community leader and researcher, Maria Conchita Posar. And regular attendees have been tuning in from across Mexico, predominantly Mexicali, and some in Puebla. And just to brag a little bit, the highest number of views that we've had for one of our episodes has been 1,400, and it was on the topic of equitable vaccine distribution. And during this episode, we had a member of the Desert Healthcare District join us and answer questions from the public. And Desert Healthcare District was the funding agent of this project. We also held Platicas en el Pueblo, or like talks in the town, which stemmed out of the reality that access to the internet and technology is a documented barrier for communities of the Eastern Coachella Valley. And so like the weekly Platicas via Zoom and Facebook, these Platicas en el Pueblo bring COVID-19 information directly to those communities. So Dr. Martin Rascon physically goes to these communities. Sometimes it's in like the front yard of someone's house with the support of the other promotoras on the team. I want to name them, Marisol and Sonia. And they adhere to county and CDC safety regulations. They limit it to 10 participants per the talks. And these began in November 2020. And since then, we've held 10 Platicas en el Pueblo around the communities of Mecca, Oasis, North Shore Thermal, and in Coachella, and with a total of 80 attendees. Oh, and before I move on, I did want to say that today is actually the last of our Platicas de COVID series. So today's our last episode. We will be holding today at 7. And some areas for discussion. The promotores are experts and uniquely attuned in identifying and engaging their communities in public health emergency responses. Additionally, social media can be just as effective in spreading crucial public health information as well as misinformation. And our last flyer for today's Platica, you can tune into our Facebook, it'll at Unido por Salud from 7 to roughly 7:30, maybe 45 minutes. Gracias, Dios me llamo. Thank you.
Thank you, Gabriela. What an amazing talk and an amazing work that you and your collaborators have done. Thank you so much for sharing it with us. We have one more presenter and then we'll have time for questions. So I really hope that everyone here is saving up lots of really great questions, because very soon we'll put out the call and hope to have a great conversation. Our last presenter is Joshua Liashenko, who is a 7th year. This is a final year in the Department of Anthropology, with also field specialization in medical anthropology, and is sponsored again by the Inequities in Health Faculty Commons. Joshua will be presenting on gender-affirming care from a distance, perspectives on telehealth among trans and non-binary therapists in Southern California.
Thank you very much, and thank you to everyone for being here today. I want to share my screen and we will get started. Okay. Oops. There we go. Hi, so again, my name is Joshua Liashenko, and my current research is based on collaborative engagement with trans activists, community members, care providers, and trans health systems throughout Southern California. My dissertation project, which is entitled Queering Care, Community Advocacy Among Trans Health Professionals, is based on collecting narrative data among biomedical and mental health care clinicians who are transgender and or non-binary, and who serve trans and non-binary patients and clients in Los Angeles and Riverside counties. So field work, pardon me, make sure, there we go. I'm currently conducting I'm finishing my field work and I'm currently writing. And this part of my research is going to turn into one of my chapters, given that I have been doing fieldwork throughout the pandemic. So it's definitely shaped the course of this research project. I argue that activism is now taking place within institutions of care where activist potential for change is from within the same structures that have traditionally reproduced unequal relations of care for trans and non-binary people. Trans medicine and healthcare is often understood as what medical anthropologist Eric Plemons refers to as a patchwork of resources, services, spaces of access, as well as barriers to care. Furthermore, the various sources of allowance, as well as prohibition for gender-affirming care are interconnected, as many institutional structures open doors to access for some, while continually holding doors closed for others. My broader dissertation fieldwork examines the lived experience of trans and non-binary physicians, licensed clinical social workers, healthcare system navigators and advocates, as well as licensed marriage and family therapists. Through the course of my fieldwork, many trans and non-binary clinicians told me they view their professional work to either be an extension of their existing activism or view their presence in healthcare spaces as their first foray into activism. Regardless of whether or not participants have a history of activist labor prior to becoming a health professional, everyone I interviewed recognized how their existence in these spaces represents a shift in trans community organizing and advocacy. This research emphasizes the role experience-informed care has within the ever-changing landscape of this patchwork that is contemporary trans health. A primary concern of my work is to learn how the personal experiences of receiving trans-specific biomedical and or mental health care directly influences approaches to providing trans-affirming and gender-affirming care. Through this lens, I examine how trans medicine and trans therapeutics is being transformed, as well as the tensions of trans and non-binary providers with their community ideas regarding loyalty, as well as their authoritative role as clinicians. So for today, today's focus of this presentation will be a subset of my subpopulation sample, trans and non-binary licensed marriage and family therapists, or LMFTs, as well as the impact that the COVID-19 pandemic has had on their capacity to provide gender-affirming care. COVID-19 has changed the way trans and non-binary mental health care is accessed by clients as well as being provided by clinicians. Physical distancing guidelines as well as extended stay-at-home orders have moved this work from the clinic into the practitioner's home and then through technological devices via internet connectivity. This work centers the perspectives of trans and non-binary LMFTs who utilize telehealth or teletherapy modalities with their trans and non-binary clients. I use the words telehealth and teletherapy somewhat in an interchangeable way, just to let you know. While research exists on the impact telehealth has on trans and non-binary healthcare systems and patients, there is a lack of qualitative research with trans and non-binary therapists regarding their perspectives using teletherapy. It is my hope that this work can help fill the gap in that research and provide a more holistic perspective on how care is being realized in these telehealth modalities. Also, I want to focus on the impact that telehealth has on gender-affirming care. I'll be outlining how patterns of telehealth use, among individual therapists and clinics coincide with an expansion of telehealth-based services. This will include those in service of capital, existing outside of insurance coverage, while also propagating the myth of universal accessibility and convenience. Also, as a note regarding language that I use, there is a quantifiable difference between gender-affirming and gender-affirming, trans-affirming, and just trans-serving healthcare. Just because an institution or provider is able or willing to see trans and non-binary patients and clients doesn't mean that that care is trans-competent. And it also does not mean that that care be void of reproducing violence. Research reflects communities. So throughout 2020 and 2021, as trans and non-binary LMFTs adjusted their practice, so have researchers. So as I was approaching adjustments to my methods in terms of doing field work, I found it really fascinating that the way that I was conducting field work, frankly, through Zoom ethnography, because I had to, was very like what my participants were doing within their careers, right? So they were having to engage with the same type of technology in order to continuously provide gender-affirming care to their communities. I have recruited care providers that live throughout Los Angeles, Riverside, as well as the Coachella Valley, and that come from various backgrounds. Of course, today I'm specifically speaking about the participants who are licensed marriage and family therapists. A lot of my recruitment came from having connections with these providers and care and activist networks prior to the pandemic, and then also connections with organizations and other providers that expanded during the pandemic, often through word of mouth, often through email, often through having personal and professional networks with providers in various regions of Southern California. I conducted semi-structured interviews over Zoom. This was less than ideal, obviously. But however, given physical distancing guidelines and a desire to remain safe and healthy, I accepted the limitations. Conducting fieldwork in this format and during this particular moment in history has allowed me to analyze the process for what it was, and being trained as an ethnographer allowed a different dimension of engagement with how I understand methods and how I understand the applications of methods in the field. So I was able to examine unique social arrangements, thinking of being in the field in a different way, as well as have plenty of moments of reflexivity regarding what is visible and what's invisible in these encounters that I'm having through digital ethnography. Qualitative data was coded and analyzed using MaxQDA data analysis software, a very helpful tool that assisted in my organization of information and actually made this presentation possible. So COVID-19 in the trans community. According to the Williams Institute at UCLA, transgender adults are uniquely at risk for COVID-19 and its associated social conditions due to disproportionate preconditions, health preconditions, as well as socioeconomic vulnerability. underlying health conditions such as asthma, diabetes, heart disease, and living with HIV all substantially increase risk of complications from COVID-19 illness. Stigma, minority stress promotes avoidance in seeking healthcare among trans and non-binary people. And this is pretty, unfortunately, pretty universal, not only specific to Southern California, but of course occurs here. Health disparities and the lack of access to affirming care worsens existing inequalities and promotes negative health outcomes. Not only is inequitable access a barrier to health, but fear of discrimination during a physical exam or checkup translates into many trans and non-binary people either delaying or completely avoiding preventative care. Also increased likelihood of tobacco use, self-description of being in poor health, and high rates of attempted suicide place further strain on trans people in general, let alone during a pandemic. Even before the pandemic, social isolation, economic disparities, housing and job insecurity all contributed to poor health outcomes, excuse me. And it should also be noted that rampant transphobia, racism, anti-Blackness, and xenophobia all intersect within and outside healthcare systems to increase vulnerability for this population. So in thinking about some of the benefits of telehealth, now, how I'm approaching this topic is thinking about telehealth in general, but then also how these care providers imagine the benefits, how they imagine the challenges or the limitations, and then how they also kind of blend those ideas together on a both personal and professional level. So overall, according to therapists that I interviewed, the benefits of telehealth were as follows. There was convenience of working from home, as well as increased flexibility. Distance and travel time was no longer a hindrance for their clients and patients. Clients can be in comfortable surroundings, often at home. And as I'll talk about in a minute, that's often a double-edged sword for many people. And there's also the potential for lower costs when seeing therapists in private practice. So since 2020 and the start of the COVID-19 pandemic, there has been an increase in trans and non-binary people seeking gender-affirming healthcare. Telehealth brings increased accessibility for those with access to technology. However, there is the potential to exacerbate inaccessibility for those most vulnerable before the pandemic, those people who already lacked technology, who already lacked resources in order to learn about and actually acquire care. During interviews, LMFTs had a lot to say about the transition to teletherapy. Some discussed negative perceptions of telehealth before the pandemic. Others mentioned overwhelming personal and professional benefits, but all acknowledge the challenges and limitations imposed by the lack of in-person therapy sessions. When asked about the perceptions of teletherapy in sessions with clients, one therapist admitted an automatic negative association. They clarified they likened teletherapy to text therapy through services like Talkspace, which they did not view as constituting good care or good therapy. There was an assumption virtual correspondence between therapist and client constituted an automatic boundaryless relationship where care would not be contained within the confines of professional and institutionalized protocols. This anxiety spoke to the general theme of concern for one's personal space and need to have a divorce between care work and personal life. The fascinating thing about this perceived arrangement that I found was that, like many who started working from home during the pandemic, myself included, this distance between work and home became almost non-existent. When asked about the benefits of teletherapy, one therapist mentioned the ability to use purchased technology as a tax write-off. And being able to lower fees due to the lack of overhead. Yeah, I love it. I think it's the best thing that's happened, at least in my personal career, because now I don't have to pay for overhead. I don't have to pay for an office, and my home office becomes a tax write-off. He continued discussing the benefits for his clients, where they no longer had to travel over long distances to access not only gender-affirming care, but also care from a trans therapist. So instead of being limited by people having to come to an office in West Hollywood, I have clients in Oakland, San Diego, San Francisco, Bakersfield, like people that would normally have to travel a long distance are seeking me out. So personally, I love it. I think it's also really beneficial for my population because they now have an opportunity to see a therapist that reflects them without having to travel far, take buses for a long period of time, save money, thus being able to afford more frequent therapy. Challenges. Ultimately, therapists I interviewed had many concerns about the use of teletherapy while they still saw the value and benefits. Challenges were most often discussed in interviews were as follows. Concerns about maintaining space between work and home, as I previously mentioned. Inability to read body language and view the whole person within the context of a therapy session. Concerns about privacy, especially for clients who are minors and or who fear disclosing being trans to people at home. Technical difficulties using teletherapy platforms like doxy.me or internet connectivity issues, as well as inaccessibility for trans and non-binary people experiencing homelessness or who lack access to a smartphone or computer in order to access teletherapy services. So concerns over privacy, especially for clients who are minors, weighed heavy on the minds of therapists. While this can be a concern for anyone during teletherapy sessions, this becomes a matter of safety for trans and non-binary clients. So in thinking of that, one participant said, so if you're trans and you want to have a therapy session and you're a teenager, you know you want to talk to me about stuff, you know your parents can be listening at the door and it can be potentially dangerous. Also, not being able to see a client, especially when discussing something as serious as upcoming surgery, left one therapist especially unnerved as she reflected on her own experiences with therapy and transition surgery. Certainly, as a trans person myself, I think that it would feel weird for me. Like if I'm going through so much of like what's a very viscerally kind of physical experience in terms of trying to feel more comfortable in my physical body and have therapists who's, of course, somebody that knows me very closely, not even able to see my body before or after these procedures, that's interesting. And that, and in that conversation, in that interview with this particular therapist, they were extraordinarily uncomfortable at the prospect of offering guidance and support when being unable to have that type of very personalized connection that they receive when they are receiving the same type of care prior to their own gender-affirming surgery. So in thinking about returning to normal, whatever that means in our post-pandemic life, whenever we eventually get to that point, while therapists offered insight into both the benefits and challenges of teletherapy, some took the time to posit possible new realities in the time after the pandemic. One therapist said, there is something about in-person that's really important. There's something about like building that rapport in that dynamic and having young people have a private space where they can actually talk, you know, about their feelings. So I hope we can have some kind of hybrid. The COVID-19 pandemic has radically altered social relations, and many would even advocate for the everyday operations of society to return to normal. Would even advocate against the everyday operations of society returning to normal or even to a pre-pandemic status quo. This sentiment rings especially true within trans and queer care networks, as a return to normal would be a return to inadequate care protocols, rampant inequalities, and unchecked systemic violence and marginalization. The pandemic offers an opportunity to reimagine the ways in which gender-affirming care is practiced, and trans and non-binary providers are at the forefront of this reconfiguration of norms. Since 2020, telehealth organizations like Folks and Plume offer gender-affirming services such as hormonal replacement therapy prescriptions, PrEP HIV prevention medication, and even recommendation letters for gender-affirming surgery using their online website or even their app. Telehealth and teletherapy is now considered to be standard in transmental and biomedical healthcare. It has yet to be seen if the relaxing of prohibitive institutional regulations that severely limited telehealth offerings pre-pandemic will be widely reinstated, or if this is simply the new reality in trans health systems. Regardless, the documented benefits to clients, as well as both the personal and professional benefits for providers, cannot be overlooked or dismissed. However, as with folks in Plume, there's opportunity for increased financial gain among these upstart gender-affirming health service organizations. While the COVID-19 pandemic can certainly be attributed to increased interest in telehealth, the desire and arguable necessity for virtual healthcare goes beyond ease of access during a pandemic. Services like folks in Plume offer gender-affirming telehealth that is accessible from websites and smartphone apps. In the same way many Californians are able to access meals, groceries, and even marijuana from a smartphone, now estrogen and testosterone regimens can be accessed with a quick tap. Folks in Plume both started serving clients in select states, including California, starting in 2020 during the pandemic. Their vast social media campaigns have brought the promise of accessible and probably what's most sought after, non-invasive gender-affirming care. However, like teletherapy, access to such services requires technology, internet connectivity. Again, these innovations that offer increased access simultaneously exacerbate barriers to the already most vulnerable members of the trans and non-binary community. In conclusion, telehealth is now currently an integral part of gender-affirming healthcare, both within a clinical system, within private practice, and now through organizations like Folks and Plume. Trans and non-binary therapists as well are well positioned to provide health systems with experience-informed feedback and guidance for the future of telehealth for trans and non-binary clients. However, uncertainty still remains concerning the end of the pandemic and the possibility of continually reproducing inequalities in accessing in-person therapy, as well as the growing ubiquity of for-profit telemedicine services. Thank you very much for being here and listening to my talk today. And I look forward to questions and comments. And here's my works cited if you're wondering.
Thank you so much, Joshua, and congratulations on this work, which I can imagine will remain relevant for a very long time in the long, quote unquote, return to normal. I would love to invite now questions in the chat with the raised hand, however you wish to deliver them. We'd love to begin a conversation. Well, while folks are formulating your questions, I have one that I'd love to put to any of the panelists who are interested in responding. And this really was stimulated by Melissa's pause for reflection, which I have to say at a certain point made me a little uncomfortable. And just thinking about why that is, you know, like, okay, I reflected, you know, like, why are we still paused? So that started me thinking about time and the ways in which time weaves through all four of these presentations. The time that Jessica, you took to narrate one phone conversation was another moment where the time of presentation seemed to shift a bit. And Gabriela, you know, you're taking the time to meet this sort of weekly space, this weekly meeting, and the experience of time of repetition that way. And then Joshua thinking about convenience and the time saved, not having to travel to be in person. So I guess that's something that struck me as weaving through all four of these, and I wondered if any of you had thoughts. And at the same time, really invite people to raise hands and put other questions in the chat.
I have a couple of words. Thank you for my fellow panelists and everyone for sticking throughout the conference to listen to us. I really want to emphasize that research takes time. Like the research with the communities that I'm working with is not going to be done on an academic timeline. However, you have to somehow make it work to the academic timeline. You know, we have our normative time to degree and whatnot, and financial support that's not, you know, forever. So I just want to emphasize that it takes time, and that's what I really tried to emphasize, and I'm glad it came across, was these moments of pause and reflection and learning, and like how to translate those moments onto dissertations and onto scholarship, so others, you know, can read and learn and be like, okay, like I'm doing things, oh, like, okay, this is an okay way to do this. So yeah, thank you for that question.
Yeah, I could say something too. As you saw in my presentation, how it takes a long time to learn a language, right? And this is a topic with instruction. We're always so focused on, we only have so much time, we can't cover all the material. Well, I think we have to also take a step back as instructors and really refocus our goals. And that's always been my goal as an instructor, is just, I just want my students to enjoy the class so they'll continue learning Spanish, because it's going to take a long time. And if they get demotivated, if they want to stop, if they're overwhelmed, then they'll never really learn. So I just want to take advantage of that one little chunk of time I have with them, just so they'll continue learning it. That's it. That's my goal. I don't really care about much else, to be honest. But yeah, I hadn't really thought about that issue of time as much until you brought it up. And I just now realize that, like, yeah, my time with them is so precious, but I want that time to be extended as well. So I try to make it pleasurable so they want to have that motivation to keep going on their own.
Either Joshua or Gabriela, if you want to, we can move on to the next question, but I want to make sure to give you time.
I'd like the next question if I can, actually. Not that the time question wasn't great too. I can talk about that too, but this next question I think is really fascinating as well. Yeah, so thank you for asking that. That is something that's very, very at the top of my mind as a non-trans queer person doing research within trans and non-binary spaces. Something that I consistently am always revisiting as I approach fieldwork. From the very beginning of, so these are the steps that I took, and I'm not saying that I have it all figured out or I do it perfectly, but at the beginning, as I was designing this project, I consulted with the key people in the community that I knew who would be key connection points to reaching other participants. And so whenever I was creating research questions, protocol, anything that I would be doing in the context of fieldwork, I made sure that trans and non-binary people were reading it. And in my interview guides with my participants, some of the last questions that I ask is, you know, how could this research within trans communities, with trans communities, be improved? And, you know, other questions that I'm not asking that I should be asking. I'm also in conversation and discussion because I do conduct research with people who have various degrees, right? People who publish things. So I'm also in conversation about like collaboratively publishing my work with people who have been a part of the research themselves. So those are a few of the ways that I've attempted to decolonize and take apart some of the hierarchies that often pervade anthropology and ethnographic work. But of course, I'm sure there's more that could be done as well.
Thank you. I'd like to invite Social to speak the question so that it's recorded on the video.
Thank you so much. I really appreciate all of these presentations. And so my question is to all of the panelists, and I just want to reiterate, how do we continue to do or implement decolonizing community-oriented practices in our research, right? Because that's some of the themes that I hear in the research that's being presented here. So would you as a researcher feel comfortable or find it appropriate to invite community collaborators to academic presentations where you are sharing your findings? And how do we take care in representation of community collaborators and ourselves in the ways that we represent ourselves. So thank you for hinting to that a little bit there, Josh. And how do we break down these hierarchies in terms of space and methods, right? So I think this is something for us to think about as we're moving forward for the calls that have been happening in general within our society, but also as we think about academia and the way that we write about it, right? So we have to strike some sort of balance in thinking about these. And so I was just hoping I can open that up to the rest of the group. And also thank you for allowing me to verbalize this for the recording's sake.
I would love to try and address the question posed by Dr. Chavez. Thank you, Dr. Chavez, for a great question. So in this research, we did use the community-based participatory approach, right, which is where it engages members of the community through all the steps of the research. It's the conception of the research question, the collection of the data, the analysis of the data, and in some particular cases, the write-up. In this case, we did do that, right? We are trying to publish some papers, we have presentations, and we've submitted to a professional conference. Most recently, we submitted to the AAA, the American Anthropological Association conference. And in doing that, we submitted for a panel in where various members of the community who've been participating in the research will be serving as panelists. The concern there is that we don't know how the AAA will be equipped to provide interpretation. And on one hand, we were thinking, well, let's just go for it. We'll figure it out as we go, but also recognizing how that might perhaps inflict some level of harm on the members of the community who require this language assistance. And so I think it goes to the point of, is it appropriate to invite community members and collaborators to these conferences that we know are not equipped, to provide certain accessibility. And in Dr. Simmons's class, we've been talking a lot about accessibility and what that entails and how it requires the individual to seek those accommodations, right? To seek that assistance for accommodation. As far as we go now, we're just trying to essentially disrupt, right, those common practices of these professional conferences, which are overwhelmingly white spaces.
If Jessica or Melissa, you'd like to respond?
I just wanted to thank Dr. Chavez for her suggestion on question and suggestion on bringing community to present with us, because I thought about co-collaboration in scholarship, but in presentations it hasn't. I guess, yeah, I haven't quite thought of that, and I don't want to. I'm glad that Gabriela shared a little bit about her concerns about bringing people in, because I don't want to see it as a sort of a tokenization, but at the same time, I don't want to speak for my community, especially when I write about it. I usually include like full transcripts, so I'm not interpreting our interviews. I'm just sharing their words as was spoken in the interview. And in my works, when I do write, I do show them drafts. I showed my participants drafts of my of this presentation and the slide and the words before I presented today. So yeah, I do try to make it a collaborative experience as much as possible, and I will think about how to bring them into presentation spaces as well. Thank you.
Yeah, I'd just like to add, I think one of the ways we in Spanish departments have to bring in the community is to stop teaching this standardized language that no one really speaks, and to have the language in the classroom reflect more the language of the community. And I think students can be their own sort of experts and ethnographers in that respect and investigate, you know, what are the linguistic trends in the community. But this is also something I struggle with as a Spanish instructor, as wanting to bring in the community, but this isn't an answer. It's just how do I work through this without, like Jessica was saying, without tokenizing, and then without having this savior complex, because I've seen a lot of other Spanish programs who try to go out into the community, but the way they do it is that there's this authority that they go and they're helping these poor communities learn Spanish or learn English or whatever it is they're doing, and there's this savior complex there that I don't think is okay. And how do we have real, true collaboration with the community is what I struggle with. So it's not an answer, but it's just something that I'm continuing to think about.
Thank you for these really thoughtful. Oh, sorry.
Yeah, and I just wanted to add to Melissa's comment, because she's also participating in one collaboration with me and other researchers right now. And we are conducting research to improve or create innovative pedagogies for deaf and hard of hearing students in the border, Mexico and the US, for university students. And recently we recorded a video for a presentation, and the whole video was signed in Mexican Sign Language by a student who is also collaborating with us. So we decided, okay, it's gonna be a silent video, but sign. And we just included slides, and we were not at all in the video, just the student signing in a video, the whole presentation. And I think it might not be the best right now, but this is an attempt, or what we thought it was best, to give the student, the deaf and hard of hearing students, the whole scenario, right, the space to present. And I think that might be one way of doing this. And of course, we included our names at the end, but the student was signing the presentation as a statement, also as a political statement.
Thank you. I'd like to invite Liz to read your question, if you wouldn't mind, Liz.
Yeah, thank you. And thank you, Dr. Chavez, for this really useful and generative question. And actually, in answering it already, several of the panelists have already started to step into the direction that I was hoping that we would be able to go, right? Is that Dr. Chavez opens this really helpful point about presentation and representation. So I guess a follow-up would be to think through, what are some of the steps process-wise that each of you are exploring in terms of decolonial process, so that by the time we get to the point of a kind of a representation for an outside group, there's already been a really robust and participatory method to get to that point?
Any thoughts about process?
Hello, everybody. I have a thought. Of course, I'm not one of the presenters, but since we're on this fine and important topic, I think it's useful to have conference structures, publication structures, academic structures that facilitate this type of research to begin with. For example, having the topic addressed in a conference abstract that then gets reviewed sort of with respect to that particular issue. So it's something to think about just in general, but then also for future versions of this conference, which I hope we will have, because I've been very pleased with how it's turned out today. So thank you all to the presenters and organizers.
I think I guess I'd like to try and address Liz's question. So in terms of right, like decolonial processes, obviously the approach that we've been using, the CBPR, it's not enough. And even in terms of getting this information out in these professional conferences, they automatically are going to exclude several members from being able to engage with the material and that's in addition to publishing. So I guess one way that we're trying to incorporate this more equitable dissemination of findings is through community forums. But then again, at this point, those have to be done virtually. That's already excluding several folks in the Eastern Coachella Valley, particularly because of a lack of access to consistent internet, or even just lack of access to technology to engage in this virtual space. So I think just being cognizant that throughout these steps, there will always be some level of exclusion. But I think acknowledging that and working towards mitigating that is, I guess, is a step forward in the better direction. And also acknowledging that the knowledge that's produced, it doesn't belong to the researcher, it belongs to the community. And so this is where, in my particular case, the promotores will guide us in how to best disseminate the findings in this research.
Yeah, I could add also, I think in terms of instructors broadly, not just in Spanish or other languages, I think as instructors, we have to honor the students' processes as part of this decolonial approach of academia, because so often we as experts expect them to hold a certain standard when it might not be possible for them, and every student is at a different level in their learning. And so I think we need to respect their processes and where they are in their development and their learning, and also reward them for their effort, not for just performing to a certain artificial standard that we might think is what they need to do. But that's really artificial, and I feel like it has to be more indicative of the real world and what skills are they going to need to apply whatever subject they're learning to the real world. And exams is a good example of this. Like, how many exams do we actually take in the real world? So why do we give our students so many exams? I don't get it, but yeah.
Yeah, and in thinking about that question, and thank you for posing it about process. I think finding opportunities to decenter my voice in how I report and showcase the knowledge that has been entrusted to me. And again, I think Gabriela was kind of getting at this as well. Like, thinking about that knowledge is not something that I own or control, but is something that has been bestowed upon me. And as an anthropologist, as a researcher, as an educator, thinking about how I can how I can show that knowledge, but do it in a way that's always in collaboration and with consent, continual consent of the communities. Also, like, I think ensuring that the types of research questions that we ask are research questions that communities want answered or actually see valuable. I feel like often we get ourselves into academia and we just, what can I do? How can I get a PhD? And that unfortunately becomes a guiding force for crafting a project. So maybe retooling that a bit and encourage, and I think that this is on an institutional ground, like framework too, like thinking how we can encourage students to think about research in a different way that centers people and what communities want or need or desire, instead of what can this research question get me in terms of a master's degree or PhD or whatever. That's just my 2 cents.
Something I just wanted to mention that I didn't get to in my paper was in thinking about decolonizing research, I also think about learning from the generations. In much of the times we think of culture bearers, we think of them as elders and as of like the teachers and the most respected people in the community. But that's not only the people we can learn from the children, we can learn from the strangers, we can learn from people who are just, meeting. I just said strangers, but you know, I'm just trying to say that I'm learning that you can learn from anyone, and you have to think about the generations and layers of learning that happens from in a family, from generations, from yeah, I'm just my mind is going, but that's where I wanted to add. Sorry.
I think we're almost at the end of this. I just want to thank you all for bringing it back in this closing discussion to where we are and to the care and communication situated, where we are situated, virtual and physical. And along those lines, I absolutely do not want to end this session without thanking enormously Claudia, Holguín, Mendoza for your co-moderation and organizational labor, less visible because of connectivity, but absolutely present and in caring for this session. So thanks to you, and enormous thanks to these four presenters and for your outstanding work.
Thank you, Dan. Thank you, everyone. Thank you for being here.